have two big needs. First of all, of course, is physical health, but also spiritual health. And that's exactly what this organization is doing. It has been doing for so many years, and Georgia herself is the saint for this organization. We're so proud of her for having started this. It's wonderful for what she has accomplished for senior citizens as well as for youth. And I'm happy to be a part of it, and I hope to remain a part of it. And I'm very proud of Don for having stuck with it, because he's had a lot of challenges, but he's managed to keep himself together.
There's no greater work one can do than to promote good health and health care. I don't care how wealthy you are. I don't care how accomplished you are. I don't care how much money you got. If you are sick, you're not in good shape. So this is outstanding work. I commend Don Doty for doing it. And Don has been the main educator in the state of Illinois, pushing the issue of hepatitis and the issue of HIV and AIDS, and has helped to educate thousands and thousands and thousands of people so that they know how to better protect themselves.
Don is a pillar of the community as founding president and CEO of the Georgia Doty HIV and Hepatitis Community Outreach. I especially appreciate all of your good work to raise awareness about hepatitis and HIV within communities of color. I have worked in Congress to support your efforts. I have spent my career in Congress working to serve the communities I represent and to protect the least among us. As long as God continues to give me good health and the people continue to give me their support, I look forward to continuing that work.
I was diagnosed with hepatitis back in about 1994, working for an insurance company. And I had just donated some blood to a blood drive. And I got a phone call saying, hey, your blood was not accepted and that you had hepatitis C. My job as director of marketing, we went by a policy of trying to educate our sales staff to avoid people that are pregnant, to avoid people with HIV, to avoid people with hepatitis. 3 months later, after the policy announcement, did I then find out that I had hepatitis. I had a strong struggle for about a couple months to decide to come out and say that I had it, to deal with it, and to talk to the administration about changing the policies for hepatitis C specifically, and they weren't going to change the policy. So I resigned. I decided to set up a nonprofit organization that dealt directly with creating awareness for hepatitis C and to provide services and quality health care. After I was diagnosed with hepatitis, I had to go through some research to figure out how I came across hepatitis. And I determined that during the inoculation and joining the Marine Corps, that they used the same air gun on everybody, and that blood would be retained onto the air gun as they shot different guys in line. And I feel that this is where most of the guys in the Vietnam War got hepatitis C. There was a sense of fatigue, tiredness, but there was no physical symptom that I was aware of until I was notified that I had hepatitis C. And then all of a sudden you begin to feel more fatigued, but that kind of comes on after you've been notified that you had the disease itself. Family is the strongest support system one has, and I was very blessed by having a wife that was a loving wife, and herself being an educator, be able to learn and go with me to the VA and sit through the explanations from the doctors about the disease. I think that once you deal with the understanding of the disease, you can overcome some of the obstacles that it has. And that's how I kind of overcome my problem, is to be able to share that information with others.
Hello, good evening, everyone. Thank you so much for tuning in to the Doty Report on Comprehensive Health. My name is Yolanda Gibbons, and I am your host. I am happy to be here. Happy 2021. This is the first show of the new year. I'm excited about 2021. We have a new president. We have a woman VP. Yes, go VP Harris. A few people have asked me over the last couple of weeks, like, what is the Doty Report? Is it my show? And I'm like, no, it's not my show. So let me just share with you guys, in case you missed my introductions several times last year. The Doty Report on Comprehensive Health is an initiative of the Georgia Doty Comprehensive Health Organization. It is a health education, health promotion show. The organization's efforts to educate, raise awareness, and even connect you, the viewers, the community, to quality healthcare and resources. For more information about the organization, go to georgiadotyhealth.org. I am simply just the host, honored to be the host. The founder and CEO is Mr. Don Doty. I always say hello to Mr. Doty and his beautiful wife, Mrs. Joyce Doty. Hello to them. This organization has been around for 20 plus years, serving the south and west side of Chicago. Mr. Doty himself comes from a long history, a great legacy, a family, his mom who dedicated even her life to making a difference in the community, and he just has carried on that tradition and that legacy. So again, for more information about this show and about the organization, go to georgiadotyhealth.org. All right, so today we are going to be talking about breast cancer. Many of you, most of you, I'm sure, know someone who have had the challenge or the experience of having breast cancer. Many of us know someone who have lost their life to breast cancer. And my understanding is, if we are more educated, my understanding is early detection of breast cancer definitely gives us a better opportunity of beating breast cancer. So I have a special guest, Dr. Ola. He has an incredible presentation for us today. Dr. Ola has a combined degree in medicine and public health from the University of Illinois, U of I, in Chicago, where he is also a clinical professor. He has a 20-plus experience in leadership and in developing, teaching, researching, implementing community-based interventions. So I am excited to be sitting here with the one and only Dr. Ola.
Hello.
How are you, Dr. Ola?
I'm fine.
Good. So we are ready for you to do your presentation and educate us. Give us more information on breast cancer.
Thank you, Yolanda. Yes, it's an opportunity to talk today about breast cancer, particularly about its prevention. So I have an overview of what I'll be talking about, today. What is breast cancer? What causes it? I'm going to talk a little bit about the symptoms. I will talk about the risk factors, the treatment options, and early detection of the cancer, because this is very significant. If we can detect it early, then we can really cure it. I will also talk about some prevention tips that people need to know, and then we talk about organizations that may support people about cancer. So the first question is, what is breast cancer? Generally, breast cancer is a cancer that starts from the breast. Cancer are cells that grow out of control. Normally, all the cells in our body, they start to grow when they touch each other. If you call the contact place, they start growing. But cancer cells don't stop. They continue to grow, and they are out of control. So the type of breast cancer will depend on which part of the breast the cancer starts from, because there are three main parts of the breast. The part we call lobules, I don't know if they can see it. Those are the part of the breast where the milk is being produced. So the cell cancer can develop from that part. We have the ducts. The ducts are like the conduits. You can see them starting from the lobule down to the nipples. So they are like where the breast milk will now flow. Then the other part of the breast is the connective tissue that really gives it the shape and the form, and of course the attractiveness. So
can you exit that full screen for me? Can you exit the full screen for me?
Exit?
Yeah, exit the full screen and just do it on the without it being in full screen. Just hit escape. Okay. Okay. Now it's showing.
Good. So, like I said, there are three parts of the breast: the lobules, where the milk is produced; the ducts that connects the milk that is produced from the lobule to the nipples; and then the connective tissues that hold every other part of the breast together. They are like the fat, all these layers, all of them are the tissue. So it depends on where the breast, the cancer starts from. So that also tells us the type of breast cancer we are dealing with and how to take care of it. Again, breast cancer can spread or metastasize and go to other parts of the body. That is what we don't want. That becomes a bigger problem to deal with when it gets to that stage. And it is one of the reasons why Doty and our organization are working with people so that if we can detect early before it gets out of the breast area, there's a high chance of curing the disease. So what causes breast cancer? That's a good question, but sincerely, in medicine, we consider breast cancer as one of the conditions we call idiopathic. We don't really know essentially what it may be, the real cause, because we have people that have the risk factor for breast cancer and they don't even get breast cancer. And we do have people who don't even have the risk factor and everything, and yet they still get breast cancer. But what we found out is there are some factors that are common among people that comes in with breast cancer. One common factor is hormonal factor, genetic factor, particularly mutation of some particular genes in the body. So if a woman have that inherited mutated genes, there's a very high chance that that woman may have cancer. Then we also know about lifestyles. Lifestyle that is sedentary, full of stress, eating unhealthy food, taking a lot of alcohol. We know all those things can cause breast cancer. And we also know about the environmental factors. We are talking about being exposed to toxins, to carcinogenic. These are chemicals that can cause cancer. All these can also lead to cancer. Then the other thing is the symptoms. Again, it's important for everybody to know about the symptoms because these are the things that the patient will first notice. And when you notice this on time, again, we are interested in detecting cancer if there is any at an early stage. And symptom is very important that people know those symptoms. So if they notice or they see any of these, they should go for more medical evaluation. Common symptoms can be a lump. The lump may be painful. For some people, it may not even be painful. Because we've seen people, oh, I got the lump, but it was not painful. I thought it was nothing about it. So again, once you notice a lump in the breast, it normally calls for more evaluation to see your doctor. It can be thickening of the skin. Some women will notice some redness or flaky skin. For some, it may be pulling of their nipples. And for some, it may be discharge. Any discharge from the nipples that is not breast milk, sure you want to go for evaluation. Either it is colorless, either the discharge has color, either it is smelly or it's not smelly, it doesn't matter. If any discharge come out from the nipples and it's not breast milk, surely we want it to be further evaluated. Then the other thing are the risk factors. What are the things that may likely increase the chance for somebody getting the breast cancer? One is age. It's normal to age. Once we're alive, we get older. But the problem is, as we're getting older, it's not a disease to get old. However, it exposes our chances to breast cancer. In fact, like in the US, most breast cancer occurs around the age of 50, and like that. I talk about some genetic mutation, particularly in those particular genes. Again, your doctors can check that out. There are a lot of procedures where they can be screened and checked so that we can know if an individual have a chance of having breast cancer. The reproductive history is also very important. When did a woman start a period and when did she have menopause? For women that start their period, like for instance, at the age of 12, and they are having their menopause like 57, that person has been exposed to a lot of years, almost 40 years, 45 years of hormonal changes. Women that have chance, that are like that, have a high chance of developing breast cancer because of a long exposure to all those hormonal changes going on every month. Compared to a woman that starts a period at maybe like 15 and then get to a menopause at 50. That's less exposures to those continuous chemical change. The other thing that also is common is about having dense breasts, which is mainly the connective tissues that hold all the tissues together. We found that women that have dense breasts may likely also have a higher risk for breast cancer. Again, we're talking about, let me move to the other slide. The other thing also is about family history. So if the mom has breast cancer, it does not mean the daughter will have it, but it does mean the daughter has a chance of also having the breast cancer. And the granddaughter also may have a chance. So if first members of your family have the cancer, so there's a chance that other member in the family may also have the cancer. Other known factors, particularly that we can control, is about not doing physical activity. Sitting down all day, doing no work, doing no exercise is not very good. We also know that smoking, taking alcohol, and all those things are not good for the body, and they can enhance somebody having breast cancer. Sadly enough, too, somebody that has breast cancer and survive first time is also likely to have the cancer another time. Again, why are we here? Treatment options. The best bet is to detect breast cancer early enough, Because if it's detected early enough, then we can start to talk about the best treatment to ensure that we can get it cured. And most of the time, we do surgery. It's the main option when it's detected early enough, and it's just to take out the cancer, take some part of the, aside some of the part of the normal cell around the cancer, and in those cases, there's very high chances of cure. However, in unfortunate situation that the cancer has started getting into the other part of the body, we have to start to use chemotherapy, which now goes into this whole system to knock out the cancer cells. Hormonotherapy is also used. So today we already now know about different hormones that there's some therapy that can serve. Most of this cancer, breast cancer cell lives well in hormones. They like most of those hormones. So there's a way you can block those hormones so they are not well fed. So that can also kill them. And then we have some radiation method that can be used. Again, the treatment will depend on which part of the breast that the cancer cells start from and the level of how it has moved to other cells. So again, the earlier the better. Again, still talking about early detection, is this self-breast examination. It is good for every woman to discuss more about self-breast examination with their doctors. You know your body better than anybody, even better than your doctor. If you can take your time, do the breast examination. If you notice if you palpate any lump, again, either it's painful or it is not painful, it does not matter. Once you notice a lump in your breast, please discuss with your doctor, and then further investigation can be conducted. So this is just a kind of schematic diagram. It's just the same thing. Raise up one of your hand, check the size, see the way it moves up and down, then start palpating around carefully. Again, you can always talk with your doctor or nurse. They can walk it out with you to show you how to do this in full. Then the other is the mammogram. You can do that annually, and it's shown to be very effective to detect the lump early enough so that we can put in place the appropriate intervention, and if there's any lump that is due to breast cancer, we can detect it on time and there can be solution to it. Then we have prevention tips that I will discuss more about with you. Then the other thing is about organization that support people. I think this is one of those organizations people want to have. I will leave this slide for a while for those who may want to note the phone numbers. So the National Breast and Cervical Cancer Early Detection Program is one of the CDC programs that is designed to support people that may need one form or the other help for breast cancer. They provide also public education on breast cancer. Incidentally, they also talk about cervical cancer too. They have free and low-cost breast and cervical cancer screening. So for those who may say, oh, in my community, how do I get the opportunity to screen for cancer? They can talk to them. You give them your zip code or stuff like that. They'll be able to provide the information where you can go to get all the help that you can need. They also provide diagnostic services to low income, to uninsured, and to underserved women. Because at this stage, we are all working towards ensuring that breast cancer, incidentally, one of the leading causes of death, the leading cause of cancer for women, is almost eradicated, at least alleviated, if not eradicated. The other area where one can get support is the American Cancer Society. They also provide cancer information. They also provide answers to any other questions that you may have. And again, you can also get in touch with Doty. Yolanda always work in partnership with the organization. So if you have any question, we can also always answer you. And then the phone number for the American Cancer Society is same there, 1-800-227-2345. Again, these are places you can go to and they'll be able to give you more information. Thank you for listening. And then if there's any question, so those are the sources from CDC, American Cancer, and then Pfizer supported this program. Thank you.
So I do have some questions. I don't know if some of the viewers that are listening in have some questions. You can type in your questions and we can try to get to them. My first question is, when do you do self-exam? When should you do a self-breast exam?
The best time to do the self-breast exam is always in the morning.
Okay.
Because like in the morning, you're just waking up, it's like all your body is well relaxed and all that. So we normally advise women that that's the best time, so that when you wake up, you're looking at your mirror, your bathroom, before you take your shower, you just do the self-exam in the morning, and it's always a better time to do it. Yes.
Okay. So if I do a self-exam every day, that's part of my routine, do I still need a mammogram?
Yeah, that's an interesting question, because we've seen people ask that question all the time. Oh, I don't have access to mammogram, but I know my body well enough, and I do the self-breast exam, I'm even good at it. And that is good, that is so excellent. If you can do it so well, because rightly so, you know your body more than anybody else, so you should be able to know any changes in your body. However, evidence has shown, compelling evidence has shown, that the mammogram is more sensitive, or should I say more effective in detecting lumps more than the self-breast exam. In fact, studies show that the mammogram can actually show a lump or a sign of a breast cancer even 3 years before you can even palpate it.
Right.
So 3 years. So, and that is a life-saving.
Yes.
So imagine somebody having a cancer cell and it's detected already 3 years before you even palpate it. That is a very good golden standard. So that's why we still want to recommend that people should still do the mammogram. It's also good enough that you're doing the self-breast exam, but annually try to do your mammogram as well.
So Dr. Ola is saying, I have to repeat this because it's so very important to us women, that we definitely should be doing self-exams. It's best to do them in the mornings before we begin our day, because with everything in our body, we've slept, we're good. However, just because you are doing the self-exams regularly does not mean that you should not have a mammogram, correct?
Exactly.
And I heard him say, I don't know if you guys heard him say, but I heard him say that we are research, or doctors are beginning to learn that you're able to detect it 3 years
with mammogram.
With the mammogram. So kind of like before it becomes cancer, not after it becomes cancer. So that is why mammograms are so important, in addition to doing your self-checks. So when, Dr. Ola, when should we have a mammogram? At what age should we have a mammogram?
That's another good question. About the time to start mammogram will also depend on many factors. The general recommendation is like from the age of 40, 45, 44, thereabout, you should start to have your mammogram.
Okay.
That is like the general standard. But again, I always advise patients to discuss with their doctor.
Okay.
For individuals that have family history with breast cancer, maybe their mom or sister or close aunt, all of them have breast cancer, you may need to start breast cancer early. Otherwise, we normally recommend that from the age of 40 to around 40, 44 years, women should start their annual mammogram.
So my daughter is 31, something, one of the ages, and my mom actually is a breast cancer survivor. Should my, and I do mammograms, I will not have breast cancer, have not had breast cancer, but should my daughter be getting mammograms now, since my mom had breast cancer?
That's a very good question. Again, it's a lot of history, you know, as I said, the breast cancer thing is a complication that is a result of many factors put together, the environmental factors, the hormonal factors, the family history, all put together. Again, because of that, she really need to talk to her doctor and let the doctor know about her family history. Okay. Oh, my grandma had breast cancer, my mom didn't have breast cancer, I just wanted to ever. So there are some things the doctor will be able to do based on that history, to be able to tell her the best time to start the mammogram.
Okay, okay. Are there things that we can do to prevent breast cancer?
At least we call it some prevention tips. We found out that this will help. We advise people to eat low-fat food. Okay. Eating low-fat food has shown to be very effective, and staying slim also helps. We advise women, if they can do without alcohol, that would be excellent, but at least do little of alcohol. Really reducing the level of alcohol will also help. Okay. It's so important to quit smoking. Smoking is not good for any form of cancer. It's not good in any way. So we always advise people to quit smoking. We also advise about childbearing, because if giving birth at early age is very, very helpful too. Like if you can give birth like before, we recommended if you can give birth on around 28 years or before that time, is much better than giving birth at later age. Wow. And another thing is also breastfeeding. I know it may sound like, oh, I may not like that, but truthfully, breastfeeding, giving birth before 28, they are very, very protective. Yes. Wow. So for women that give birth so early and all that kind of thing, it also helps a lot. Okay. Again, you got to know your breast. You got to do the self-breast exam. You got to do the mammogram as often annually. And if there's any observation, normally your doctor will let you know. So yeah, those are the things that we have found to be so helpful. At least when people keep to those, they are very helpful preventive tips against the breast cancer.
Good info, good info. So what about, you mentioned resources. Let's share with the viewers again, resources, where to go to get screened, and if there are resources, if they are diagnosed with breast cancer. Because a lot of times people, especially in the underserved communities and minority communities, they get it, they have a doctor, they kind of know, but they really don't really know what resources are really available for them.
Yeah, that's good one. Again, they can dial the number to contact the National Breast and Cervical Cancer Early Detection Program. Again, this is a program of the government, specifically designed to help people so that if there's any lump or any form of sign for breast cancer, they'll be able to take care of it, and they provide all the resources and help. So again, their phone number is 1-800-232-4636. 1-800-232-4636. Another good resource is American Cancer Society. Their number is 1-800-227-2345. 1-800-227-2345. So again, Doty is also a very successful organization. They can always reach them, and if they need some information, we can always find a way to get this support.
Right. So this has been a great presentation. I learned something new about the mammogram in that kind of early 3 years before it even happens. It's so important to that's why mammograms are important. So We do have a question from a viewer. We talked about this a little bit. The question is, can breast cancer be passed on genetically?
Unfortunately, yes. If somebody's mom has breast cancer, again, we got to get this fact. At the early stage, I did mention that there are people who may have the risk factor, but they don't necessarily have breast cancer.
Right.
It's just more like an awareness and to be more conscious of yourself. So yes, if the mom, the aunt, and sisters are all having breast cancer, for instance, the chance that the person will have breast cancer is very high because it means it runs in the family. It can be passed on genetically.
Right.
But again, it's still after most cases there are other environmental factors. Maybe the mom had the tendency or the chance to have breast cancer. She was working in a place where she's being exposed to radiation and all that. That can make the breast cancer to come out, and then she had the cancer.
Right.
But she had a daughter who doesn't move near radiation.
Right.
She is always away, take care of herself, doesn't smoke. She may not even have the cancer.
Okay.
But again, it's important to let your doctor know your family history so that we can able to determine your risk for the breast cancer.
Okay. Okay. So genetically, your risk is higher, but it doesn't mean that you're necessarily going to get breast. There's other factors that we have to think about as it relates. I don't know, viewers, if you have any other questions, please chime in. This is such an important topic. We definitely need to have more awareness. I don't know too many people that don't know someone that have had survived breast cancer, and many of us know people that lost their lives. And a lot of it I'm hearing is lack of getting early detection or lack of resources. But one of the things that I have learned from doing the Doty report and just having the pleasure of sitting with people like yourself, doctors and people in the healthcare profession, a lot of it is our lifestyle and how we live, what we eat, what we do, what we're around, if we smoke and drink, exercise, comes into play as it relates to many of the different things. And breast cancer is also, sounds like it's one of those things.
Exactly.
That we have to consider as our own personal lifestyle and being preventive. I don't know if any other questions out there. No more questions. So Dr. Ola, what are some final words that you would share to the viewers as it relates to breast cancer?
Thank you. Again, what I want to say to every viewer is to take this information seriously. And again, Georgia Doty, Vanota, we want to reach the whole world with this information, but we can't. But you can be our mouthpiece. All this information that you got, we expect you to kindly share this information with other people, particularly members of your families, members of your communities, or people that you know have one need of question about breast cancer. Please share this information with them. Get back to Georgia Doty for more information if you have to, so that as many people can get all this information. Information is powerful.
Right.
Many people may be missing out. Like the scripture says, people perish for lack of knowledge.
Absolutely.
It's another way people can perish without knowing all this basic information.
Right.
So it's always helpful to pass on the information to other people, and that would be so great if you can do that.
Well, I appreciate you. I'm sure our viewers appreciate you. Thank you so much for being here, for sharing this information, for letting us know that there are resources out there. What can I say? He said it. Knowledge is so important, and sharing of that knowledge is even more important. We have got to take accountability for our household and our communities and hold each other accountable for living a better and more healthier lifestyle. We have to. you know, if we don't take care of each other, who's going to take care of us? So I just want to encourage and challenge everyone to something that you may have heard today as it relates to breast cancer. Make sure that you share it with your daughters, with your girlfriends, and men get breast cancer too, right?
Yes, they do.
Men get breast cancer too. So make sure that you are sharing the information that has been shared with us here today. Understand that there are some risk factors. Understand that we can decrease the risk factor. And one thing that I heard so important is that early detection. So that means we have to be doing the self-exams, and we have to make sure that we get our mammograms and talk to our physicians, talk to our doctors about our family history and the background, and check ourselves on what we're eating, drinking, smoking, and how we're taking care of ourselves and our environment, the things that we are around. And know that there are resources out there. If you don't remember, the easiest one that I heard today that I know that we all know is the American Cancer Society. So if you can't remember any of the other resources, and there are plenty, the American Cancer Society is one that sticks in all of our head. You can always reach out to them, and I'm sure that they can provide you with some support, resources, or kind of give you some guidance for some help. Again, go to GeorgiaDotyHealth.org. The Georgia Doty organization is in the trenches and really trying to educate, empower, and raise awareness in our underserved communities, in our minority communities, in the communities who tend to miss out on quality health care. So support the organization, find out more about the organization, and I just encourage all of us, if we haven't learned anything from 2020, I hope that we have learned that it is so important that we live a much healthier lifestyle. So that is it for tonight. This has been the Georgia Doty Report on Comprehensive Health. I have been your host, Yolanda Givens, and we will have Dr. Ola back in 2 weeks. So stay tuned for that. Have a good one.